And good afternoon. Today is Friday, and that means it's time for our regular Lunch and Learn. Now, today we're going to be talking about fluoroquinolones. Now, that's a big, big word, and you have been in contact with this set of drugs, but you may not have known it. So I want to give you a little bit of information because these are very widely prescribed antibiotics, but they come with a black box warning now. They didn't used to have a black box warning, but they do now. And so a lot of times when you're sick and you go to the doctor and the doctor says, oh, you've got an infection and you need antibiotics, and you say, yes, I don't feel well, I hurt, I've got this, that, or the other, whatever it is. And so you're very glad to get that antibiotic prescription, and you go to the pharmacy and you take it and all that kind of thing. Well, this particular class of antibiotics is called fluoroquinolones, and it might sound like the word fluoride, and it does, because these antibiotics are fluoridated. Okay, and so we know that when you have fluoride in your body, now fluoride is an element that is a naturally occurring element out in the real world. That is okay. That's not what we're talking about. We're talking about fluoride that is made from processed insecticide, processed manure, the manure plants, all that kind of stuff. The runoff water has fluoride in it, and that's what they're making fluoride for your toothpaste, fluoride for all the other different things that we need fluoride for. We know that that kind of fluoride is a neurotoxin, and so we don't want to be doing that. So this particular class of antibiotics is made from fluoride. Okay, so the common names for these are Cipro, you probably have heard that before, Levaquin, and Avelox. And so these are three of the most common. I think there's like 7 different drugs in this class. And so when you are at the doctor and you need an antibiotic, I mean, hopefully you don't, but things happen. And, you know, a lot of times people think that because I'm in the holistic world that I don't want to have any kind of medication ever, you know, nonstop. That's not really true. If you are in a crisis, thank God we've got medicine. You know, medicine is not a bad thing, but we don't want medicine to be a lifestyle. When medicine is a lifestyle, then you've got complications because you've got side effects and different things like that. So what we're talking about is the side effects of taking this particular class of drugs. One of the major side effects is irreparable muscle damage. So that means that once you have the muscle damage, you cannot undo it. All right. So what is your biggest or most important muscle in your body? It's your heart, right? So this particular class of antibiotics gives you irreparable muscle damage, among other things, okay? So there was a lady that took this class of antibiotics for a simple UTI, and she had extreme reaction to it. And she said that she felt like a 90-year-old in a 50-year-old body. So that's not good. Nobody wants to feel that way. And so, you know, just make sure that when you're doing antibiotics, you're not doing it from this particular class. Now, I say that with a caveat. If you've got antibiotic resistant bacteria, then these fluoroquinolones are probably the only ones that are going to work. So we want to make sure that these antibiotics are the last resort, not the first resort. So as I said earlier, Cipro, Levaquin, Avelox, these are some of the brand names of this type of antibiotic. They are designed to battle bacterial infections, urinary tract, respiratory, and skin conditions. And so how many of us have never had a UTI? We all have. How many of us have never had a skin condition? We all have. How many of us have never had a respiratory condition? We all have. And so we probably all have been exposed to this in one way or another. Now, I will just tell you, for me, myself, whenever I start to feel bad, I start taking natural antibiotics and antivirals, and I'm able to take care of things before they reach a crisis stage when I need to go into the doctor and get antibiotics. I don't think I've had antibiotics for probably 20 years. And the only reason I had antibiotics then is because I had a small surgical procedure And they're always going to give you antibiotics when you go into surgery. So it was an elective procedure. I had a tiny umbilical hernia that the doctor said as I got older that my skin would become more fragile, and why not take care of it while it was tiny and they could do it laparoscopically rather than wait till I'm older, have a rip, have to go in, make a lot of incisions and that kind of thing, which I thought was wise, even though I don't like all that kind of stuff. You have to do, and you have to make choices and do what's right for you. So it was right for me at the time, and they did give me antibiotics. Don't remember honestly what they were, but that was the last time I had antibiotics. So these fluoroquinolones are broadly effective. They reach deep into the tissue to combat the bacteria, and they disrupt their DNA cycle, which means they kill the bacteria. So they're very, very effective. They were approved in 1980. All right. Fluoroquinolones are fluorinated antibiotics, explained Dr. Mark Heil-Mealey. I hope I didn't mess that up too much. A board-certified internal medicine specialist and the founder of Regenerative Medicine LA. The fluoride allows the drugs to penetrate into the nervous system. Now, I'm just going to tell you, nothing should penetrate into your nervous system. Your nervous system is mission control of your body. And when we have something that penetrates that, then we can have all kinds of issues. So there is a term called being floxed. Never had heard that term before I read this report, but that is for people who have had fluoroquinolones, have had negative side effects. This is a real term. There are Facebook groups that you can find. There's all kinds of self-help groups that you can find. And I didn't really even know this was a thing because I stay away from antibiotics. So the spectrum, besides muscle tears, tendon tears, that kind of thing, can include severe neurological and psychological effects, often leading to irreparable impairments. And so one of the things I think I remember reading was you can have audio hallucinations from taking these kind of medications. So if you, if you've exhausted every other class of antibiotics, and this is something that you may want to do, but if you're somebody, and I know plenty of people that come in to see me in the clinic and they have UTIs every year, they have antibiotics every year, and they've got all this stuff ongoing, you're not going to be one of those kind of people that want to have this type of drug every single time. So research indicates that fluoroquinolones double the risk of aortic aneurysm and aortic dissection. So what does that mean? Well, your heart is here. This is my left side. Your heart is right here, and you've got a major aorta that goes down into your abdomen. So they have something called the widowmaker. I don't know if you've heard that term, but that is when you have an aneurysm in your aorta, and it causes that blood vessel to split. And when it does, you can bleed out in just a matter of moments. And so that's why they call it the widowmaker. And we don't want to do that. We don't want to have that. That's something that's very, very serious. My mom happened to have been laying on her husband's lap, and she could hear some gurgling, and she didn't think that was something that she was supposed to hear. So he went to the doctor, and sure enough, he had an aortic aneurysm, and they were able to get him in, get that fixed. And so he's still alive today, and we're very glad that he is. So we don't want you to be taking this kind of drug unless you just have to. And in full disclosure, he had some kind of procedure. He did take Levaquin, and he suffered after that a ruptured Achilles tendon, and then we had this aortic aneurysm. So we know from personal experience that these kind of drugs are really, really important. So antibiotics have also been associated with QT interval prolongation, which is a precursor to sudden cardiac death. So you're going to have to talk to your cardiologist about that. I don't have time to tell you all about that today. Millions are taking these antibiotics unaware of potential long-term consequences. So most patients with severe side effects from fluoroquinolones encounter skepticism from their healthcare professionals who regularly dismiss any correlation between the medication and the symptoms. Now, these kind of medications can be given to you in an IV intravenously, or they can be given to you in a tablet. So how many of you, and I'm going to raise my hand too, how many of you have gone to the doctor and you said, I don't feel good, blah, 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 this is what's happening. And the doctor says, oh, well, it's all in your imagination, or, oh, your blood work looks fine, so we don't really know what to do. And then you're frustrated because you know something's wrong and nothing is going to be done about it because your blood work is quote unquote okay. So let me tell you what that means. When the doctor says that your blood work is okay, that means you are not in a disease process. That doesn't necessarily mean that your blood work is okay. In our Western medical model, the doctors are trained to listen to your symptoms, give it a label, and then there is a pharmaceutical protocol that's going to help you. And sometimes there's multiple ones. You know, we've got multiple blood sugar drugs. We've got multiple blood pressure drugs. We've got multiple drugs. And so there's, you know, we have a lot of options here. But they're not going to be able to do that until you're already in a disease process. So holistically, we have a much narrower reference range. And so we know when you're trending toward a disease process, and hopefully we can grab you and bring you back in so you never make it there. So what we're finding with the Floxed people is that they go to their doctor and they say, look, I've got this, that, and the other. And the doctor says, well, I'm not sure why you have that, but it's not a result of the medication. So that's kind of a sad thing, because we know, according to this report, the FDA had to put a black box warning on the drug now. Now, how many of you, I do, if I ever have to take a drug, or if I'm looking at drugs for customers, I will go to the patient insert information and I will open it up. I usually do it on my computer. I'll open it up and I will look for black box warnings. We don't want to take any kind of medication that has a black box warning. Just throwing that out there. If you don't know that, I'm telling you, you don't want to take anything with a black box warning. Now, this Dr. Heil-Mealey, G-H-A-L-I-L-I, I hope I'm saying his name right, has personal experience with these drugs. He had a Cipro prescription in 2016 for a minor infection that left him wheelchair bound during his medical residency. He subsequently was healed. He was supported by alternative and regenerative therapies, which inspired his lifelong work to work with people holistically. Now, I'll tell you what, anytime that you have something that happens to you and you're able to overcome, then you want to bring that overcoming to everybody else, because it can happen. And so he has made his business, it is restorative medicine. And what that does is it goes in and undoes all the damage that the prescription does. Now, according to the medical profession, it is irreparable. That means there's no drug for that. When your doctor tells you this is incurable, that means there is no drug for this. That doesn't mean holistically that it is, something that you have to live with for the rest of your life. You just have to take a chance and do something different, okay? Dr. Heil-Mealey discusses the understated dangers of the fluoroquinolone antibiotics in a video on his YouTube channel. Now, his YouTube channel is called Regenerative Medicine RA. It underscores these drugs' capacity to cause cellular turmoil, especially in disruption of critical enzymes that are harmful to the mitochondria, which is the powerhouse of the cells. So just so you know, inside every cell in your body, and we have trillions of cells in our body, inside every cell in your body, you have a little powerhouse, an engine called the mitochondria. If your mitochondria gets damaged, and that's what this class of antibiotics does, then you're not going to live a long time, and you're not going to live in perfect health because your mitochondria has been damaged. So this is one of the reasons that I love the Pharmanex products that we have here in the clinic, because they are all about anti-aging, and they're all about repairing cellular damage, repairing mitochondria. And there's not a lot of things out there that you have access to that is going to help you repair your mitochondria. Our food, our fruits and vegetables, even if we buy organic, are not nutrient dense enough for us to have what we need in order to repair ourselves. And so I just want to encourage you. I'm encouraged that we've got a medical doctor who is saying there is hope. There is hope with regenerative medicine that will go into the mitochondria and repair that. In the video, he says that fluoroquinolones disturb the DNA gyrase, which is an essential bacteria enzyme triggering tendon injuries and mitochondrial dysfunction. Injuries, not industries. And mitochondrial dysfunction. He urges a reevaluation of these liberally subscribed drugs within the medical field. Cipro is a powerful antibiotic used to treat a wide range of bacterial infection, including the respiratory, skin, and UTI, which we already talked about. According to this doctor, he says the core problem lies in the drug's fluoride content, which enables deep access into the central nervous system and mitochondria, where it can impair cellular operations and cause muscle weakening. Fluoride is the root of the problem for individuals with fluoroquinolone toxicity. So we know that people have fluoride because fluoride is in all of the major toothpaste brands, right? So even the one that I use, which is a new skin, and I use it because it's whitening and it's just good and I love it and it's anti-plaque and that kind of thing. But I get the non-fluoride variety because I know that fluoride is a neurotoxin. Fluoride is in our vaccines. Fluoride is just in a lot of different, it's in our water and that kind of thing. And so we don't want to take that. And so, why would we take an antibiotic that had fluoride in it? Now, fluoride is a heavy metal. You can detox from it. You need a professional to help you. You're not going to have the skill to do it by yourself in most cases. So the most important thing to remember about this class of drugs is that the effects are cumulative. That means the more you take the drug, the more often you take the antibiotic, the more likely you are to have these severe side effects because the effects are cumulative. All right. Patients may look normal, but internally there is significant mitochondrial damage. He said that the drug's hidden but significant side effects are symptoms that usually emerge in the patients, including persistent disturbances in energy production, plaguing them for years after taking the medication. He noted that an increased susceptibility to fluoroquinolone toxicity exists in individuals with specific genetic predispositions or previous fluoride exposure. And he notes that women are more disproportionately affected because of variables such as MTHFR. Now, that sounds like a bad word if you say the word all the way out. And it's just like, it is polysyllabic for sure. But what that means is your cells, you're lacking an enzyme to be able to do the Krebs cycle conversion in your cell. What that means is you're not able to detox properly. Many people have MTHFR. There's about 3 or 4 genes. I haven't seen anybody that has all 4 genes disrupted. I myself do have heterozygous disruption. And what that means is that one of my sides of my chromosomes has a problem, the other side does not. So I'm able to kind of, do what I need to do and be able to detox properly with a little bit of extra help. But there are some people that are very damaged at the cellular level, and it's nothing that you did. It's just the way you're born. It's just the way the chromosomes came together. But there are things that we can do to help you with that if that is you. Now, I remember years ago talking to my mother and asking her to ask her doctor if she had MTHFR. She asked the doctor said she didn't know what she was talking about. So you might have to educate your doctor, but Google MTHFR and it will tell you all about what that is. And so if you have this, you're going to have more of a problem processing the fluoride. And so you want to make sure that you figure this out. We have a swab here in the clinic. You put it inside your cheek for 1 minute on this side, 1 minute on this side. You pop it back in its container. You mail it off to a lab. The lab is not going to share your information with anybody else. It's just going to share it with you and me. And it will tell you if you have this MTHFR brokenness in your genes. And if you do, there are things that we can do about it to help you detoxify better. Okay, so it's really good information to have. And so if you want to take advantage of that, you can call the clinic. You don't even have to be in our area. We can have it mailed to you, and then you can fill it out, and we'll see where you go with that. So the FDA's first significant step to regulate fluoroquinolones occurred in January of 2008. Now, when were these drugs approved by the FDA? In 1980. In 2008, they introduced the black box warning. It is the sternest advisory to notify healthcare practitioners and patients about the risk of tendinitis and tendon ruptures. This initiative spearheaded a sequence of actions to reduce the usage, including a 2013 update to their potential cause of irreparable muscle damage. So by 2016, the FDA further intensified the warning for all systemic fluoroquinolone antibiotics, stressing their dangers and recommending they be reserved for conditions lacking alternative treatments. So like I said earlier, if you are someone who has antibiotic resistant bacteria, and that's because you've been on antibiotics for a long time, right? That's not good for you. But if you are that way and you're in a crisis situation, you may not have a choice, right? And so we're glad we've got this class of drugs, but we don't want this to be our first line of action. So the black box cautions side effects can occur hours to weeks after exposure to fluoroquinolones and may potentially be permanent. On July the 10th in 2018, the FDA announced that it was requiring safety label revisions for fluoroquinolone antibiotics, amplifying the alerts regarding possible mental health consequences and severe low blood sugar reactions. The update also spotlighted other dangers, including attention disruption. So anybody have brain fog? Anybody have ADD as an adult, right? Disorientation, agitation, memory loss, and the uncommon yet grave risk of hypoglycemic coma. So that's when your blood sugar gets so low that you just can't function. The psychological risks of fluoroquinolone medications have generated increased concern. In June of 2019, the Southern Network of Adverse Reactions, led by Dr. Charles Bennett, a physician known for his research on preventing adverse drug events and enhancing drug safety, submitted a petition to the FDA requesting a black box warning for the psychiatric risk associated with the fluoroquinolones. Despite supporting testimony from more than 100 affected patients, the FDA refused to update the black box warning, saying that they didn't have enough evidence to put that in the warning. Well, I think 100 people that are effective is pretty significant, especially if they're asking me to take that kind of drug. I would like to know that if I take that drug, that I might have some problems with my psychiatric abilities, right? My mental abilities. The FDA's response has frustrated advocates who contend that the psychiatric risks, especially regarding suicide, are not being effectively conveyed to fluoroquinolone recipients. So internationally, in January, this January, the UK's Medicine Healthcare Products Regulatory Agency reinforced restrictions on fluoroquinolone antibiotic use, allowing this prescription only when there is no other alternative. Even with increasing recognition of their hazards, fluoroquinolones are still prescribed at concerning levels in the United States. In 2019, 13.7 million Americans received a prescription for this class of antibiotics. And in a 2018 study, they found that many of those prescriptions were unnecessary, stating that analysis suggests that a quarter of the fluoroquinolone prescriptions were given for conditions for which no other antibiotics are indicated, and for which fluoroquinolones are not recommended as first-line therapy. Okay, so breaking that down, a quarter of those prescriptions were given for conditions that did not need any antibiotics, right? And they were given for conditions where fluoroquinolones were not the first drug of choice. So that's a lot of people that are being given these medications that they don't need it. In search of the FDA's adverse event reporting system, concentrating on the 3 most commonly prescribed fluoroquinolones, which I told you earlier, reveals that the ongoing effects of this drug category. In 2023, the database showed 7,288 adverse events reported and 779 deaths with these 3 antibiotics. It is a significant increase from 2 years earlier with just 340 fatalities. So we take an antibiotic to prevent us from dying, right? Because we've got a raging infection. But this class of antibiotics can also cause death. And so this is something that we need to know. It's something that we need to pay attention to. And this is why we give you all of this information on these programs so that you can be aware, especially as we are all getting older. And thank God we are. But as we get older, we have more opportunity to break down. We have more opportunity to get sick. We have more opportunity that we might need to go to the doctor. And so what we want to do when we go to the doctor is we want to be informed. And I always tell my people that come in, I am the queen of this body, and I am going to listen to what the doctor says, and then I'm going to make the best choice that goes with my convictions, goes with the way I feel, goes with the way I understand things. And if I don't understand, I'll get some information before I make a choice. So you've got to be your own best advocate, because our Western medical model is the standard of care. One size fits all. So if you're 20 and you go in and you have XYZ symptoms, you're labeled XYZ disease, you're going to have XYZ protocol. If you're 50, the same. If you're 70, the same. If you're older than that, the same. One size does not fit all in our, just the way our bodies are. I mean, I love to eat meat. I'm a carnivore. I could do the carnivore diet like that. I don't, because it's not healthy. You need fruits and vegetables. And so I eat fruits and vegetables. I eat a lot of fruits and vegetables. In my church, and a lot of churches, they'll do the Daniel fast. Now, the Daniel fast is in the Bible, so I'm not going to say anything bad about the Daniel fast. If you want to do that, that's fine. But me, I can't do the Daniel fast. I need protein every day for my body to work the way it needs to, and it's just the way my individual body works. Does that mean the Daniel fast is wrong? No. Does that mean the Daniel fast is bad? No. That just means that it's not a fast that's suitable for me. So in the same way, standard of care may or may not be suitable for you. And if you know more, you can do more. If you can make a better decision because you have more information, then you're going to have a better outcome. All right. So why are doctors prescribing these fluoroquinolones when we know all these problems are happening? Well, physicians are overwhelmed by a high volume of drug and their safety updates, and they may not be fully aware. The affordability of the fluoroquinolones compared to newer, more expensive antibiotics and their broad spectrum efficacy makes them an attractive choice. And some doctors prioritize immediate bacterial eradication over potential side effects. So break that down. That means your insurance may not cover something else. Okay, so you have to be your own best advocate. Now, you probably, if you look at the way things are holistically, you probably never need to have antibiotics again. Okay, now there are crisis situations where you're helping somebody in a flood and you're in all this nasty water because of sewer water and all that kind of stuff, which we know because we live in this area where that happens a lot. You're helping somebody escape from a submerged car, you get cut, you've got an open wound, you've been in this nasty water, yes, get yourself to the doctor and get antibiotics, right? Because that is a crisis situation. But if you wake up and you have a little bit of mucus, that's not a crisis situation. And we can teach you how to handle that naturally. So within 24 hours, it is gone and you don't have to resort to pharmaceuticals, as wonderful as they are, okay? So there are a lot of people that are affected with this. They're affected with the side effects. It's very, very difficult, if not impossible, to repair the tendons. And the lady that we talked about at the very beginning of the program, her muscles and tendons keep tearing. I'm not quite sure how long it's been since she had the fluoroquinolones, but her whole life has been disrupted and nobody knows how to work with that. Now, maybe if she got in touch with that doctor, that he would be able to help her. But so far, the medical profession just don't know how to deal with that. And so this is something that is drug induced, is caused by the drug. And so we want to make sure that we are well equipped with all the information that we need so that we can make the best of the situation. Now, if you are someone who has had a course of antibiotics, and then you've had another one, and then you've had another one, and then you've had another one, what you're going to want to be on the lookout for is that you don't develop a condition called C. diff. Now, C. diff is a bacterial infection because you have been overprescribed prescription antibiotics, right? It can be that that's not you, but you have had antibiotic and you've not responded. You've had another antibiotic and you've not responded. And for some reason, you've got antibiotic resistant bacteria. In those cases, you probably are going to want to go to this particular class of drug because it disrupts the DNA cycle of the bacteria. But what we don't want to do is to have this to be our first step if we have a bacterial infection. So lots of information. If you have any questions, put them in the box. Thank you always for liking, sharing, commenting, doing all the things that you do, because this helps the algorithms with Facebook. And we know that the more likes and all that we get, the more Facebook shares. And this is important information because I don't know how many of you out there have already had this type of antibiotic and are saying, oh man, I wish I had known this before. So now you know, and you can make better choices and you can avoid some of these serious side effects. So it is the weekend. What does that mean? That means rest, relaxation, restoration. If you need help because you have had overprescribed antibiotics, come and see us. We're able to go in there, repair that DNA, do that kind of stuff that is regenerative and restorative. So I'm going to say goodbye. I'll see you next Friday. Thank you for your time and have a great, great weekend.